Hello, everyone. Thank you so much for helping out. My name is Ransom Onima, a final year radiography student, a medical writer, and also a YouTuber. Today, I have an amazing guest speaker all the way from the UK. Hey, Olivia, could you introduce yourself to the audience?
Yeah, of course. My name's Olivia Burns. I'm the founder and CEO of a company called Hypoplastic. I'm a health tech and innovation consultant, and I'm currently studying towards my MBA in health from the Global Business School of Health at UCL.
Amazing, amazing. So, Olivia, we have a couple of questions for you to answer. You ready?
Yeah.
All right. So, the first question for you is, your journey thus far, from surviving hypoplastic left heart syndrome, to becoming a healthcare innovator. So talk us through about your journey thus far, from surviving hypoplastic left heart syndrome to becoming a healthcare innovator, which is truly inspiring. So how has this your personal health story, shaped your passion, for transforming healthcare systems today? Talk us through.
Yeah, of course. So, hypoplastic left heart syndrome is a very rare congenital heart condition. Yeah, it was when I was born. It was the surgical techniques were very new. I was one of the first survivors in the UK. I had 3 open heart surgeries and 18 other procedures on top of this to basically reconstruct my heart and to circumnavigate my circulation. So yeah, I spent a lot of time as a child and as an adolescent in hospital having, huge surgical intervention. Um, and this kind of really inspired, my journey into healthcare and healthcare innovation because, we were like on the forefront of medical advancement within HLHS, and I received life-saving surgeries, and without those surgeries, I would be dead today. There's no doubt about it. People born with hypoplastic left heart without surgical intervention, they live for about 3 days. The longest survivor is 3 months. So without that surgical intervention, yeah, I wouldn't be here today. And that's really what inspired my journey, is that I've seen what healthcare innovation could do for a person's life and for an individual's life. And it can give you the freedom, since, I had my Fontan this year, I celebrate 15 years of having my Fontan, which is my final open heart surgery. And my oxygenation rates went from 72% to 98% overnight. It completely changed my life. It's given me years with my family, with my friends. I've built a business, started, making a real impact within healthcare. I have 2 degrees now. So I've seen personally through my own personal journey how impactful healthcare innovation can be. And I want to be able to, make sure that other patients have access to that life-saving treatment, but also to an improved patient experience. My patient experience was not ideal because in the cohort that I was born into, patient experience was something that was kind of on the back burner. We were mostly focused on the surgical intervention, but now we have the technology, we have the hindsight, we have everything else to improve patient experience. So that's something else that I'm really passionate about as well.
Amazing. Wow. Your story is incredible, Olivia. Thank you so much for talking us through about your journey thus far with surviving a very chronic ailment, hypoplastic you know left heart syndrome. And during my little research, I noticed it's a killer disease amongst many, you know, especially adults as well, and even kids between below 18, 16, 17, 18, thereabouts. And it's 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 incredible that you survived, that um, crazy disease. And I know that your story is a testament that everything things is kind of like possible. If you're watching this video and you're facing some kind of like ailments, I think Olivia's story is a testament for you that you can, conquer that ailment you're passing through, and to move into another direction right now. Look at Olivia. When you look at her, you won't even notice that she passed through hell. I don't want to digress further into that diseases because it's a whole lot. A lot of chats about some low percentages of people, surviving this deadly ailment. And in the UK, she's among those that survived it. And we're really proud of you, Olivia. You feel the strength, and I know that the audience are really inspired by your journey. So thank you so much for talking us through about your journey thus far and how your personal study, health story has helped you, shape your passion, for transforming healthcare systems today. So the next question for you is, has the founder of Hypoplas, you know, an NHS clinical entrepreneur, what gaps in healthcare are you most passionate about solving through strategy, innovation, and human-centered design? How you gonna do that?
Yeah, well, when I first started Hyperplus, I based it on my own patient experience. So it was what I do in Hyperplus is I designed a more dignified, sustainable, and cost-effective hospital gown. And I saw that as a huge gap in the market was that we were still using generic hospital gowns. We were moving into an era of AI, and health tech and med tech was taking leaps and bounds and advances moving forward, but patients were still being forced to wear the generic hospital gown, which has been in circulation for over 100 years. And then the more that I researched into the generic hospital gown, patients hated it. Clinicians couldn't stand it either because it ruined efficiency. They couldn't get lines in, they couldn't get access to wounds, things like that. It was creating medical textile waste through, gowns just being thrown away and disposed of. We have a huge double gowning situation as well. So patients, to preserve dignity, wear one on the front and one on the back. So per patient, you're laundering 2 gowns per patient, which is, in theory, doubling carbon, but also doubling laundry bills. So it's creating this huge black hole of money, resources, time, carbon, all these sorts of things. So I designed the gown not only to be patient-centered, so that, patients had the access and the independence they needed, but it was about bringing in every other stakeholder and making sure that, the gown worked for every stakeholder that had interaction with that product. And that's something that, has really followed me through my career, is this assumptions gap. We have a very big assumptions gap within healthcare, which is what the people who are doing procurement, policy, research, all these other things that are strategizing, what they think all the end users need is huge. These people who are working up here, don't have any connection to the people who are actually on the front lines down here. So this assumptions gap is massive, and it's really, having a massive effect on our healthcare systems. We're spending millions of pounds on, software that basically falls at the forefront because the end users can't interact with it, patients can't interact with it, clinicians think it's a waste of time. So, and then we also have things like research. Research is taking place, and they're not looking at the things that are actually going to make an impact on a patient's life. A lot of research is based on clinical data, and what patients are finding is that clinical data does not match up to their own patient experience or to their own quality of life. And then we have, things like that are happening in procurement. procurement are buying things that people, that end users, clinicians don't need, or over-regulation. We have a huge problem with over-regulation in medical textiles, where we have so much patchwork, just putting plasters on the problems, because we can't get the policy changes and the regulation changes that we need to actually start bringing in effective medical textiles on the front line. So something that I'm really passionate about is that assumptions gap, and how we bring clinicians and patients into things like research, policy, procurement, to make sure that we're delivering, the strategies, the insights, the innovations that are actually going to make an impact on the front line. Because I really believe that one of the reasons our healthcare systems are so out of sync is because all stakeholders are not being brought to the table. And once we do start including all the stakeholders, then we can actually get a 360 viewpoint of what our healthcare system needs to move forward and to future-proof. So that's kind of what my work is mainly focused on.
Amazing. Olivia, something came up. I know that it wasn't an easy journey to finding that amazing um company you're running right now, Hyperplast, right? So talk us through, because I've spoken with med students, medical doctors in the UK, and they have organizations. They founded they're CEO of organizations, NGO organizations that do incredible things in the healthcare system. And so, talk us through, Olivia. How was the process? How was the journey for you to finding this amazing company organization that you're running right now? How was the journey for you?
Well, patients have a very they they have a more difficult time than clinicians, I would say, when they start a company, because clinicians kind of already have a viewpoint of how the system works, how procurement works, how do we get things into into the front line. They're also able to be a clinical champion, so they can really push through their innovation. They can get the research they need. They can take it to procurement themselves. They can do everything by themselves. But when it comes to patients, they are pretty much thrown in at the deep end. And that is what I had to do with Hypoplastic. Is I was thrown in at the deep end. All I knew is that I wanted, and that was the path that just led me to where I am today. So, I started with, first of all, I had to get IP. I had to get the IP to protect my product. So that was the first hill. Then we had to get financing. So I managed to get Innovate Santander. We took a grant from the University of Manchester as well to develop it further. Then I went on to the NHS Clinical Entrepreneur Programme. So I was part of the first cohort of patients to go onto that programme. And that taught me about the NHS and, how you get things procured, how you get your feasibility study. It also opened up my network to, open by myself. And then when I did decide to go back to university and study at UCL on my MBA in health, that's when I finally had a systems viewpoint. So I'd, gone from business level to healthcare system level, and then I went to global healthcare system level, and what it looks like, what's the impact on all industries when you bring in a new product. So it was a lot of self-taught things, and I think when you're an entrepreneur, whether you're a clinician or a patient, no one can really give you the path. You have to really make your own path and make your own mark, and make mistakes on the way. You might find a mentor. Mentors are really great, but sometimes you got to go out there and just make the mistakes yourself, get the rejections, get the knockbacks, and also just start. So many people are like, well, I'll start it when I do this, or I'll start it when I'll do that. It's like, you can't prep, you can't prep for innovation or for entrepreneurship. It doesn't matter how hard you prep, the lessons come on the journey. So the best thing to
Yeah.
do is start.
Mm, mm. Yeah, amazing story. Because everybody that has a company they're running, um, it wasn't easy for them to, you know, get that company introduced to the world because, you know, there were no. I was speaking with a med student in the UK. She created an app, that tracks, like the women's periods and all those kind of thing, pregnancy kind of things. And she was that app because of a lot of things that happened, but she really succeeded. So that's why the audience was really intrigued by your story, and as well wanted to know your journey thus far and how you founded that company right now. And I believe that they're really enlightened the more. So thank you so much for talking to us on how you know created that amazing company we're running right now. So the next question for you is, being both a USCL MBA health candidate and a future leaders scholar, how do you balance academic rigor with real world strategy, consulting, and entrepreneur work? How are you doing that?
Um, well, I'm very lucky because everything I do feeds into one another. So, everything that I'm doing in my career right now, it's all aligned to that one career goal, which is to, make an impact, deliver health innovation to patients, improve patient outcomes. And everything I do just feeds off each other and bounces off each other. And I'm really fortunate to be in that position. So it is, a lot of hard work, definitely, and you have to have time management strategies in place, and you have to have your support networks. I have a great personal and professional support network that helps me with, my my very big workload. But it's, the entrepreneurship is supported by what I learn at UCL, and that helps me give me that, systems level, working at that business level. The themes that I study at UCL feed into my consultancy. So I have a lot of companies come to me, with assistance with whether it be the patient voice or marketing or business strategy and business modeling. The things that I learn on my MBA is that, what is happening in the future of health? What does the future of healthcare look like? What are the mega trends, and how are healthcare systems and healthcare companies, how can they move to fit these mega trends? And that's that's something that feeds into my consultancy all the time. And those are ideas that I can take into Hypoplastic as well. Do with Hypoplastic is around pushing the patient voice, making sure patients are have access, improving the patient experience and things like that. And one of the big trends that is happening at the moment in healthcare is that healthcare systems and companies are looking to actually have more patient involvement, more patient engagement, but not just, through tokenism, not just on a round table after everyone's made the decisions. That's not what's happening. It's they want to bring patients into the operational level. They want to bring patients into their business model, their business structure, because when we're looking at health tech and we're looking at med tech as well, and all this software that's being developed, the people, they're building it for patients. Patients will be the ones at the end of the day that use these softwares, that use these apps. And if you cannot get this app to communicate effectively with the patient, you can't scale, you can't raise money, you can't be commercially viable. Design a product like that, then you have to bring patients in at the very beginning and very early stages. And that's something that I really work with in consultancy, but also within my own business in Hypoplastic. And that's something that, my MBA in health has given me the confidence to pursue that path, because it has been identified that that is the movement that is happening within healthcare at the moment. I mean, all you have to do is look at the boom that's happening in medical tourism at the moment. That is patients making decisions about their healthcare. They are directly choosing to go to other countries to have medical treatment or surgical intervention. And it's patients moving into this consumer role, which I don't think healthcare industry really knows how to handle yet. So that's something that being a patient, a long-term patient for 18 years, I have that patient expertise, but I also have that industry expertise, and I understand how to bring, the two together into a really strong business case. And that's really what all of my, all of my projects that I have running and things like that. I do more work outside of my consultancy. I work, for a lot of CHD foundations as well, making sure that children born with, congenital heart conditions are also getting the care that they need, because, they don't have a voice. They're a pediatric patient. So it's making sure that even pediatrics have a say in their healthcare as well. And that's kind of what everything feeds into, is making sure patients have a voice and a place within healthcare. Yeah.
Amazing, amazing, Olivia. That was a great one on how you balance all those academic rigors you have on your plate, and we're dealing with real world strategies, your consulting work, and also your entrepreneurial work. Amazing. So talk us through you know one of the courses I did my second year, psychology and radiography. My lecturer will say that in a hospital setting, the patient is the king. The reason why the doctors is in the hospital, the surgeons, the radiographers, all health specialties are because of the patient. And it's amazing to hear from you that all these amazing innovations in healthcare industry, and only the patient are going to use it at the end of all the processes and the technologies used and all those things. So I want you to tell us something, Olivia, before we proceed to the next question. Um, she, I was speaking with a doctor in the UK, but she works in the NHS, and all of a sudden he made a transition. He left NHS to Canada to work because of, I don't know what happened. So that's what really got me intrigued. Why he left NHS to Canada to work as well. To talk us through, how is the healthcare UK healthcare system right now, and is it benefiting you, or is something lacking behind that you need to fixing or something?
Fortunate position. I mean, I wouldn't say fortunate, but unfortunately, I was born with a very rare condition. But that means that, because my surgeries cost £1 million, I'm the first survivor in the UK, and everybody needs my data. I've received the best treatment, world-class treatment, from the NHS, and I really can't complain. I have annual checkups. I have a hotline to my consultants. I have everything a patient would really want from a healthcare system, from a public healthcare system. And there's a lot of people born with HLHS in America, and they still have to deal with the fees and things like that does come with HLHS. So it's, and only when you go out and you see other healthcare systems, you realize how lucky you are to have the NHS. But the NHS is struggling, it is struggling. We have now a huge aging population that's only going to grow. We have comorbidities as well. So we have a highly stressed, healthcare system because of these things that are naturally happening within our population. And it's I find the leaders within the NHS have a really difficult decision and have a really difficult time at the moment, because there is really not much money. They're having to lead and strategize and pivot without having the budget to do it. And that is a really complex and, you know, difficult position to be in. Definitely one I would not like to be in myself, to do that. But, you know, I think we talk about, when I was speaking about that assumptions gap, you know, that assumption gap definitely exists within the NHS. And so that's why we have, you know, we need to make sure that the clinicians and the patients are really talking to, you know, the people who are making policy, the people who are making strategies, the people who are bringing in innovation. And that's happening. You know, when I was at Confed last week, there was a lot of talk about moving to a flatter structure, you know, removing the hierarchy and moving to more of a, you know, a local decision-making situation rather than having a centralized decision-making system as we used to have. So it is positive that we're moving to a flatter structure, definitely. You know, and also GPs who are kind of on the forefront, you know, they're the gatekeepers to tertiary care. You know, the amount of GPs are decreasing slowly, and the amount of patients demanding to be seen by GPs is increasing. So they're under a lot of strain and stress as well. So wherever you look within the system, it is under stress. But I think what is going to improve that is if we can get the innovations that we need into the system. And that's another barrier. You know, we have a very slow adoption rate within the NHS. And what we need to do is we need to make sure that the innovations that patients need, and like the digitization that we need of the NHS as well, is happening at a faster rate. Because if we don't get those innovations in, if we don't digitize, you know, we're going to have, you know, we're having problems now, but I don't know what the kind of problems we're going to be seeing in about 5 years' time if we don't start innovating now. And that's a big problem is in the NHS is sometimes they can't see the opportunity loss. It's very short-term thinking. And, you know, the NHS needs to be looking at what are the long-term benefits of bringing in this innovation. What could this do over 20 years, over 30 years? Where could we get the healthcare system, you know, there in the future? So I think we need to be looking at innovations that are going to future-proof the NHS and to take the stress off the healthcare system.
Amazing. Thank you so much for talking us through about the current concurrent UK healthcare issues and how you've benefited as well. But yeah, I believe that things will be done. You know, you guys, the prime minister is working towards it because a lot of I was seeing the post on TikTok. Um, Many GPs are going to lose their work or something like that. But I know that you know things will turn around definitely, and if they stick with providing more innovations, more techniques, in order to making the patient's health worth living as well, because everything we do in the healthcare is because of the patients, right? So in all things we do is just to make the patient well again. So if they should, adhere to those innovations, it's going to go a long way for them. So thank you so much for talking us through, Olivia. Next question for you: what does truly human-centered healthcare look to you? Sorry, and how do you embed that vision in your work with Hypoplastic?
I think the step towards that is co-design, and that's pretty much it. Is we need to make sure, I'm talking about this assumptions gap so much in this episode, but it's because it does exist and it's really harming not only healthcare systems but patients. So I think the only way to get to patient-centered care and design is through co-design, collaboration with end users, making sure end users are being put at the tables where decisions are being made, are being empowered to be decision makers themselves, are given access to contribute in a meaningful way. No more, tokenism or anything like that. It's, making sure that, you know, they are having an active role in what happens in their future care, and enhancing the patient experience. You know, there is a lot of focus on enhancing, you know, clinical, clinical innovation, but also clinical outcomes, things like that. And of course, you know, but it should be, you know, we need to make sure that we're monitoring patient outcomes and that we are improving things like survival rates and, you know, quality of life, and making sure that we don't have readmission rates, you know, decreasing readmission rates as well. But there is so much focus on the clinical stuff. There is no focus on the experience, on patients' experience. And I think how patients receive care, you know, whilst they are being hospitalized, can impact how successful they are when they do get discharged. And we see that a lot within, you know, my own condition, within long-term patients. You know, the surgeries that they receive, the care that they receive, if it's highly traumatic, you know, these children, when they grow into adolescents and adults, they receive they experience a high level of PTSD, and that can really stop them from being as successful as they really could be, being successful contributors to society, things like that. So we need to make sure that we are enhancing the patient experience and putting patient experience innovations at the forefront as well, so that, you know, like I said, to make sure that these patients are really being successful when they're discharged. It's not just about, you know, it's not just about if they survive the operation, or, you know, if their recovery was under 7 days, or, you know, does it improve oxygenation? It's not always about that clinical data and clinical things. It's about how patients are able to live their lives in the real world once they've received, you know, their intervention.
Amazing, Olivia. Thank you so much on how, you know, talking us through on how, you know, human-centered healthcare, you know, looks, you know, like you, like in your own perspective, and how you've, you know, grabbed that vision into your work with Hyperplast. That was amazing. And so the last question for you, but before we go there, the kind of work you do, is it basically in the UK? Does it diverge to other countries as well, or other continents as well, like Africa, you know, or North America or something like that? Is it basically in the UK?
Yeah, most of my work is based in the UK, and that's because I know, you know, the receiving care from the NHS, and, you know, attempting to scale a company in the NHS as well. But the work that I do around HLHS is when we are looking at rare diseases and rare conditions. The most innovation does happen in, you know, big continents like America, because of the population. You know, there is a much bigger population of people living with hypoplastic left heart syndrome in America than there is in the UK. I mean, in the UK, there's like 1,000 of us, a few thousand of us. You know, it's so small, and the surgeries for my condition were being completed in America in the 80s. But in Europe, they didn't really they weren't really, you know, scaled or completed until the 90s. And my surgeon, there were 2 surgeons who were doing my procedures, the Norwoods. They were the only 2 surgeons in the UK for about a decade before anybody else started doing them. So if you're looking for, you know, groundbreaking innovation, a lot of it is happening in America because they just have the bigger population than what we do. So a lot of my work out there, a lot of my work around HLHS is based in America. I have, you know, within my MBA, I did a lot of field work in the UAE, which was, you know, amazing. We got huge insight in how the UAE healthcare system operates, and the patient experience they have out there, the innovations they have scaled out there are really amazing. And that is a region that I would love to explore more and to work more with. We're completing our final project now, which is about the medical tourism market within the UAE and within the UK. And it's been so interesting to compare the two to each other and to see, what is happening in the Middle East and what market they're trying to capture within healthcare.
Amazing. Thank you so much. I was thinking if your research was just basically in the UK. Yeah, amazing, amazing. Thank you so much, Olivia, for that nuggets right there. So let's proceed to the last question. Olivia, you've been an amazing guest speaker thus right. So the last question for you is, yeah, definitely. There are a lot of clinicians that are gonna watch this video. A lot of doctors, home and abroad, both in Africa, both in Nigeria and the UK, because most of my demographics on my YouTube is UK here, a little bit African, Nigerians as well, and a lot of young leaders as well are gonna watch this video. So tell us, for young leaders out there or clinicians, looking forward to move beyond the bedside into healthcare innovation and safety. Tell us, what mindset shifts or practical steps would you recommend based on your own journey thus far?
Be bold, I would say. Take really bold steps towards your goals, and be confident about it. One thing I was never confident about was like, who's going to listen to a patient? Who cares about the patient voice? And I think a lot of clinicians also feel that way, is, I'm just employed to work here. Who's going to care about my opinion or, about my innovation? Or, I don't have the literacy in policy or procurement or research to really, make a difference or make an impact. And I think that's just not true. I think the people who have the ability to make the biggest impact are end users, like clinicians and patients, because they're the closest ones to the problem. They understand, the pitfalls, they understand the system failures, they understand, what happens daily on a ward. They understand the impact it has on patients, the impact it has on people's lives. They are they're dealing with real people every single day. And I really think they're the best ones to lead us forward into what does healthcare look like in the future, because they understand what healthcare looks like now, in a very real way. And they're able to really understand, well, if I want to work here in the next 20 years, what would I improve? What innovation would I like to see come onto the wards? So I think being bold and really empowering yourself and really, having the confidence to stand up and say, yeah, my opinion does matter, my experience does matter. And in the NHS, with the NHS Clinical Entrepreneur Programme, we've seen a whole healthcare understand the benefits of having end user innovations implemented within the healthcare system. So that's a whole public healthcare system that is supporting clinician and patient-led innovation. So I think every other healthcare system should definitely be sitting up and watching that. I think Australia as well, they have their own version of the NHS Clinical Entrepreneur Programme. And, in America, they have lots of avenues and ways and accelerators are at the forefront of innovation and transformation within healthcare systems. And also, when you do move into that kind of innovation space or wanting to be a leader and things like that, I would say have a systems point of view. Don't just look at that one thing that you do every single day, that one job every single day. Take it from a systems point of view. And that's what I always say about patients, is that, you know, clinicians are amazing. They go in, they do that one bit within the system every single day, and they do it really, really well. The version of that system, you know, they receive the letter, then they go for the consultation, then they go for the pre-op, then they go for the surgery, you know, then they're discharged, they do the recovery at home, you know, then they do the follow-ups. They see the whole system, and they really, patients have that natural macro point of view and systems thinking point of view. And I think that's why patient experience is really valid and valuable, because they have that systems point of view. And clinicians need to just move into that systems point of view. How is your innovation going to improve on that larger scale? You know, how's it going to make that impact over a whole healthcare system or over a whole country? And question everything, I would say. You know, that's the main thing of being an innovator, isn't it? You know,
Absolutely.
yeah, doctors and clinicians, you know, that they're taught in medical school, this is how it's done, this is how it is, this is how it'll be for the next 50 years. But sometimes it just takes one person to question the status quo, and you know that and that whole question can turn into a whole innovation, can turn into a whole system change, can impact patients in a better way. And it's the same with patients. You know, we're told to be grateful for the care that we receive, and you know, then just go on and get on with your life, and that's it. You know, and I don't think that's really good enough anymore. You know, we are obviously grateful for the care that we receive, but we can see that it can be done in a better way. It can be delivered in a better way, you know, and maybe a more efficient manner as well, because we have that systems thinking. So even patients as well should be questioning, well, is this right? Should I be receiving care in this way? You know, is there a better way of doing things? Do I want the next person who's going to go through this, do I want them to feel this way, or do I want them to receive care this way? So I think really questioning things and questioning status quo is something that, you know, medical students are never taught to do. But if you want to be an innovator, then you do have to question. You have to question everything. So that would be definitely my biggest piece of advice. And if you're a leader as well, you know,
Yeah.
if you want to lead and become, you know, dynamic within your leadership and bring, you know, get people on board with your ideas and things like that, then you also have to question how other leaders are doing it. Are they doing it in the right way? Are they just leading people down another pitfall? Or, you know, so I think, yeah, that would be my advice for anybody who's thinking of moving into innovation, definitely.
Amazing. That was an amazing nuggets right there. Olivia, thank you so much for your time today, Olivia. That was amazing, and I believe that the audience are really inspired the more about your journeys. You know, into digital information innovations, transforming healthcare systems into a better place for the clinicians or the GPs, and also for the patients as well, and also being a survivor of a very killer disease amongst many people out there with that same disease, hypoplastic left heart syndrome. I believe that the audience are really inspired by your journey. So if you wanted to connect with Olivia, her details will be on the LinkedIn, on the YouTube description below. So if you want to reach out to have get questions, if you need some consultations about one or two things happening, maybe to your health or something, or if you have questions about this session, she's willing to answer you as well. So before we wrap up the session, do you have anything to say before we wrap up the session?
I hope that, you know, some things that I've said have inspired people to, you know, improve our healthcare systems and to move things forward and to innovate. Because, you know, we need you. We need all stakeholders, and we need as many people as possible to tackle this problem. You know, health is a really important part of our lives. And I think, you know, the more people that realize that, the better. And I hope my journey has inspired people, and that, you know, there is it took me 18 years before I was discharged and I was told to go and live my life, but it was a long slog, but it was definitely worth it. And I hope, that applies to innovation as well. As the innovation is a long slug, but when it pulls off in a very good way. So, yeah, so sometimes I compare my health journey to my innovation journey, and yeah, I'm just getting started basically. So,
Amazing.
yeah.
Amazing. Thank you so much. So we've come to the end of the session. Do well to, like, share, and subscribe as well. Thank you. That was amazing.